The spread of polio around the world has become so serious, it is now an international public health emergency. According to the World Health Organization, Marie Francisco reports from the Netherlands.
The World Health Organization is calling for international response to the public health emergency brought about by the global spread of wild polio virus. The WHO has declared outbreaks of polio in Asia, Africa, and the Middle East as an extraordinary event. Here's WHO Assistant Director General Bruce Aylward speaking to reporters in Geneva.
The situation as of today and April 2014 went unchecked. It could result in failure to eradicate globally one of the world's most serious vaccine-preventable diseases.
From January to April 2014, considered the low transmission season for polio, the virus has been exported to 3 countries in 3 major zones. In Central Asia, from Pakistan to Afghanistan, in the Middle East, Syria to Iraq, and in Central Africa, Cameroon to Equatorial Guinea. The World Health Organization names Cameroon, Pakistan, and Syria as the leading potential transmitters of the virus to other countries. The WHO says these countries should ensure that all residents and long-term visitors are vaccinated before traveling and provided with a proof of vaccination.
The first is at the head of state, or at the level of the head of state or government, the interruption of polio transmission should be officially declared a national public health emergency, if this has not already been done. The second recommendation issued by the Director General is that these countries ensure that all residents and long-term visitors to these countries receive a dose of the oral polio vaccine or the inactivated polio vaccine between 4 weeks and 12 months prior to travel, to international travel. The third recommendation is that these countries ensure those travelers undertaking urgent travel, that would be within less than 4 weeks, and have not received a dose of OPV or IPV, should receive a dose of the polio vaccine at least by the time of departure, as this will still provide some benefit, particularly for frequent travelers.
The trigger for the WHO's action was the discovery that there have been 74 cases of polio so far this year. That seems like a low number. However, it becomes alarming when compared to 417 cases in the entire 2013. Winter is considered polio's low season, but with the warmer and wetter climate, polio spreads faster. Internal unrest in those countries also compounds the problem. Delivery of vaccinations is hampered. In the current polio hotspots, Pakistan has 59 of this year's 74 cases. In Syria, the disease rebounded in 2013 with incredible speed. Polio usually strikes children under the age of 5. The virus enters the body through the mouth and multiplies in the intestines, attacking the nervous system, potentially causing total paralysis in a matter of hours. Initial symptoms are fever, fatigue, headache, vomiting, stiffness in the neck, and pain in the limbs. Based on UN figures, 1 in 200 infections leads to irreversible paralysis, and among those paralyzed, 5 to 10% die when their respiratory systems become immobilized. Noting the rising trend of infections in part of Asia, Africa, and the Middle East, the UN and its partners have relaunched massive vaccination campaigns in Syria, Iraq, and Egypt, aiming to reach 22 million children. The WHO wants to eradicate the disease, which is transmitted in contaminated food and water everywhere, by 2018. For more information on polio and prevention, the public may check the sites of the World Health Organization and the Polio Eradication Initiative. In the Netherlands, I'm Marie Francisco reporting for Eagle News Service.